Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Dewi Novitasari. I'm from Nutrition Department of Politeknik Kesehatan Kementerian Kesehatan Semarang. Today, I'm going to give a presentation about the importance of iron tablet supplementation for pregnant anemia. Introduction. Pregnancy is a period of nutritional crisis that has many health problems. Anemia of pregnant women has become a problem of micronutrient deficiency in almost all countries around the world, especially in Africa and Southeast Asia, including Indonesia. To overcome this problem, the Indonesian government has promoted iron tablet consumption, but there are many pregnant women who have not taken iron supplements during pregnancy. From this problem above, this essay will explain the importance of iron tablet supplementation for anemic pregnant women. There are 4 parts in this essay. Firstly, the definition of anemia and iron tablets. Secondly, the causes of anemia in pregnant women. Thirdly, the effect of anemia in pregnant women. And last, the nutritional needs of anemic pregnant women. Before further explanation about pregnant anemia, knowing the definition is an important thing. Anemia is a condition characterized by a decrease in hemoglobin levels, the number of red blood cells, and disturbance in meeting oxygen needs. In pregnant women, anemia is characterized by low HB levels, which are less than 11 grams per deciliter. The rate of anemia in pregnancy in Indonesia, according to risk test in 2030, is around 37.1%. In conclusion, anemia in pregnancy can cause harmful effects for the mother and fetus. After knowing the definition of anemia during pregnancy, we will discuss the factors that causes anemia in pregnant women. The first is predisposing factors such as knowledge. Enabling factors to include the availability of facilities and infrastructure or health facilities, and reinforcing factors including family support and health workers. Based on research, there is a relationship between anemia in pregnant women and the incidence of premature birth. In addition, knowledge of pregnant women is also associated with the incidence of anemia. Teenage pregnant women with low weight gain during pregnancy, KIK, and low intake of energy, protein, folic acid, and iron are at risk of giving birth to babies with low birth weight. Anemia can also occur due to low iron intake and absorption, which can be caused by consuming foods containing phytate and phenol. In concluding, many factors cause anemia in pregnant women, which include predisposing, enabling, and reinforcing factors. The next discussion is anemia, which has several negative impacts on the life of mothers and children who are born. Anemia is associated with an increased risk of maternal morbidity and mortality during childbirth because pregnant women who are anemic have the opportunity to experience bleeding during childbirth, which can result in death. The negative impact on the mother, among others, is associated with difficulty breathing, fainting, fatigue, increased heart rate, difficulty sleeping, perinatal infection, and preeclampsia. In addition to the mother, anemia also has an impact on pregnancy outcomes, namely babies born with intrauterine growth retardation, premature birth or even miscarriage, and babies born with low body weight. Anemia of pregnant women also has an impact on the baby being born, the possibility of having little or no iron reserve in the body. To conclude, the effects of pregnancy with anemia have a negative impact on the mother and the child being born. Given the harmful effect, it is necessary to prevent anemia by increasing the consumption of nutrition food and giving iron tablets to pregnant women. Iron is a very important element for forming red blood cell or hemoglobin. Giving iron tablets during pregnancy is one way. Forming red blood cell or hemoglobin giving iron tablets during pregnancy is one way to increase HB levels. Giving iron supplement as much 60 mg per day. Ministry of Health recommended pregnant women take at least 90 iron pills during pregnancy. In addition to increasing nutrition intake, pregnant women in the first trimester are given an additional 190 calories of energy, 20 grams of protein, 6 grams of fat, and 25 grams of carbohydrates. Meanwhile, pregnant women in the second and third trimester are given an additional 300 calories of energy, 20 grams of protein, 10 grams of fat, and 40 grams of carbohydrate. To conclude, increased intake of nutrients, especially iron, is very important for pregnant women because it can help increase blood hemoglobin levels. Conclusion. In conclusion, the role of iron supplementation for anemic pregnant women is recommended. This paper argues that anemia in pregnant women harms both the mother and the child being born. Anemia can be prevented and overcome by consuming nutrition foods, especially those containing high iron, and regular iron supplementation can also increase blood hemoglobin levels. Thank you for your attention. If you have any question, you can write them in the comments.